we as a country took on the challenge of staring down COVID-19 because we believed that decisive action, going hard and going early, gave us the very best chance of stamping out the virus. And it has. We have done what very few countries have been able to do. We have stopped a wave of devastation. Our transmission rate, that is the number of cases that each person with the virus passes it on to, is now 0.48, less than half a person each. Overseas, the average is 2.5 people. We have amongst the lowest number of confirmed cases per 100,000 people in the world. We have a relatively low proportion of serious cases, and according to the Oxford University Coronavirus Government Response Tracker, one of the lowest mortality rates in the world. Nearly every case identified since April 1 is primarily as a result of overseas travel or contact with someone with the virus, and often in existing clusters. The number of individual cases that we don't have an obvious connection in that period now stands at only 8. Our testing has scaled up, and we've now tested over 85,000 New Zealanders, one of the highest testing rates per capita in the world. In the last few days, we expanded testing to include random testing in Queenstown, the Waikato, Canterbury, and Auckland. We've tested over 1,000 people this way and so far have produced not a single positive result. The Director General of Health is confident that there is currently no widespread, undetected community transmission in New Zealand. In short, the effort of our team of 5 million has broken the chain of transmission and taken a quantum leap forward in our goal to eliminate the virus. Elimination doesn't mean 0 cases. It means 0 tolerance for cases. It means when a case emerges, and it will, we test, we contact trace, we isolate, and we do that every single time with the ambition that when we see COVID, we eliminate it. That is how we will keep our transmission rate under 1. And it is how we will keep succeeding. And we have seen success. You, all of you, have stopped the uncontrolled explosion of COVID-19 in New Zealand, and I couldn't feel prouder of the start that we have made together. But I also feel a huge responsibility to ensure that we do not lose any of the gains that we have made either. On that basis, New Zealand will move out of Alert Level 4 lockdown at 11:59 p.m. on Monday, April 27, 1 week from today. We will then hold at Alert Level 3 for 2 weeks before reviewing how we are tracking again and making further decisions at Cabinet on the 11th of May. In making this decision, Cabinet discussed in depth all of the data that we have shared with all of you daily. We looked at the gains we have made in our results, but also our systems. We considered that the longer we are in lockdown, the less likely it is we will need to go back. We also considered moving alert levels on the 23rd of April, which is in just 48 hours' time. The sacrifice made to date has been huge, and Cabinet wanted to make sure we lock in our gains and give ourselves some additional certainty. Waiting to move alert levels next week costs us just 2 more business days, but gives us much greater long-term health and economic returns down the track. It means we are less likely to have to go backwards. Ultimately, we have taken a balanced approach, and one that the Director General of Health not only supported, but also recommended. This time we now have will be used to prepare on all fronts.